The Parliamentary Budget Officer just released a damning report that revealed the healthcare program used by bogus asylum claimants will cost Canadian taxpayers over $1.5 billion a year. Yes, $1.5 billion. Thanks to a Conservative-led investigation at the Health Committee, we now know the true cost of this disastrous program. In 2016, the Liberals expanded healthcare coverage for asylum seekers to include supplemental health benefits. According to the government, these benefits include, and I quote, vision care, counseling, assisted devices, home visits, nursing homes, transportation, taxes, and other supplemental services such as physiotherapy, occupational therapy, speech therapy, and interpretation services.
The information we received says that for the last fiscal year, so 24-25, the supplemental benefits represented a bit over 50% of the total health expenditure of the program, and that category was growing as a contributor. So in our projection, that proportion would grow.
According to the Liberal Immigration Department, asylum claimants remain eligible for supplemental benefits even after their claim has been rejected by the Immigration and Refugee Board. Yes, after they've been rejected.
During the time that they are in Canada, before they are, if they are removed and they failed in their claim for appeal, then they would still be eligible for interim federal health.
This has allowed bogus asylum claimants, individuals who have been rejected, lost every appeal, and have no legal right to be in Canada, to cash in years of taxpayers-funded supplemental health benefits that millions of Canadians don't even have access to. Bogus asylum claimants are literally getting more benefits under the Liberal government than many Canadian seniors who built this country.
Our cost estimate includes the cost for all eligible beneficiaries, no matter where they are in the process. And we've modeled, according to the guidance we've received for IRCC, about when beneficiaries would exit the program. And so in the case of successful claimants, that would be when they would become eligible for provincial or territorial health benefits. In the case of unsuccessful claimant, that would either be when they leave Canada after exhausting all avenues of appeal, they are judged ineligible at the IRB and ineligible for pre-removal risk assessment, or they've withdrawn or abandoned their claim.
This is even for rejected claims, right? They've been rejected. This is including rejected claims.
Yeah, some of those beneficiaries would have had their claim rejected.
And how long can these bogus asylum claimants receive their benefits for? Well, according to the Immigration Department, right up until they leave Canada, whatever that might be.
For these people that are coming into Canada on bogus asylum claims, receiving health care funded by Canadian tax dollars, including supplementary care like dental, vision, medical devices, and mental health services that many Canadians don't even receive, do we know how long the coverage lasts if they're rejected?
It lasts until either their status changes and they're covered under provincial health care, or once they depart Canada.
How is this fair while millions of Canadians can't even access the most basic health services like a family doctor? But it gets worse. Doctors openly testified at the Health Committee that physicians are billing up to 5 times the rate of provincial rates through this program.
Federal health programs, which are often considered uninsured or not covered by provincial health plans, often cost our system substantially more money and require more resources for several reasons. Namely, this is because services are not covered by provincial plans. Physicians can bill up to 5 times more their physician fees for these programs, including federal programs that support refugee claimants. Often we need language lines and translators online for extended periods of time, and additional time is required to obtain consent, dispel misinformation, and communicate with these patients.
This raises serious concerns that doctors are now financially exploiting the program that has little oversight or accountability. Conservatives have already put forward common sense solutions. This includes removing federal benefits from ineligible claimants, except in cases of emergency medical care. Conservatives believe in supporting the most vulnerable and in protecting a fair and compassionate asylum system. But that system is now broken, and the Liberals have allowed it to be abused for far too long. Canadians shouldn't have to pay over $1.5 billion a year so bogus asylum claimants can receive better health benefits than Canadians themselves are entitled to. Immigration policy must consider health care capacity. Failing to do so is failing both Canadians and those we promise to help.